Hello, my name is Dr. John Whitfield, and today we're talking about urinary incontinence. Millions of women suffer from urinary incontinence and don't seek care. They think it's just part of being a woman, or that major surgery is their only option. Nothing could be further from the truth. So today let's talk about urinary incontinence. First, there are two basic types of urinary incontinence. There's what's called stress incontinence and what's called urge incontinence. Stress incontinence is any time pressure is put on the pelvic floor, such as coughing, laughing, sneezing, or lifting something heavy. Pressure from above pushes down on the pelvic floor drops, the valve opens, and the patient leaks urine. And for that, we typically do surgery. The other kind of incontinence is urge incontinence. This is the irritable bladder. Gotta go now. And that we usually treat with medication. Well, how do we evaluate a patient with urinary incontinence? The first thing to do is to take a history. Find out how long have the symptoms been occurring? Under what conditions do they occur? What are the precipitating factors? We'll then perform a physical exam with a focus on the low abdomen and the pelvic region. We may do some urinary tests such as a urinalysis or a urine culture. And then frequently it's hard to tell which type of incontinence people have just by talking to them, because what sounds like one may be another, and a certain percentage actually have both. So there's a special test that we can do called urodynamic testing. And in this test we put fluid into the bladder, fill the bladder, look for the irritability, have the patient cough and strain and see what kind of pressure she generates, and then measure the pressure in that valve. And then we know whether it's stress incontinence, urge incontinence, or both, and whether she needs surgery, medication, or both. Now with urge incontinence, we treat that with a medication. It's a pill, and frequently that works very, very well and relieves the patient of her symptoms. For stress incontinence, it's a little bit different. In the past, it meant major surgery with a hospital stay, large incisions, and an extended recovery. But advances in technology now give us some minimally invasive options for the treatment of stress incontinence. One of these is called a vaginal sling, and it works like this. The urethra is the tube that goes from the bladder to the outside, and it sits at an angle. When a patient coughs, sneezes, laughs, lifts something heavy, pressure from above pushes down on the urethra, it drops, it flattens out, the valve opens, and she leaks. So what we do is a procedure called a vaginal sling, where we take a strip of material that's about 4 inches long and a half an inch wide, and we go in vaginally and we bury it in the pelvic floor, and it sits underneath the urethra. Now when the patient coughs or sneezes, the urethra hits the sling and it acts as a backstop, and it works very, very well. 85% of women will tell you they are completely dry, 10% get some improvement, only about 5% fail. So the odds are very, very good. If you suffer from urinary incontinence, talk to your doctor and find out what your options are. Again, my name is Dr. John Whitfield, and I'm a board-certified gynecologist. My staff and I look forward to the opportunity of meeting you and taking care of your needs. We offer timely appointments, specialized care, and a level of service you'll appreciate. For an appointment, consultation, or second opinion, give us a call today.